So the frequently asked questions: can egoism ever be a positive force in healthcare? Yes, egoism can inspire personal growth and encourage self-care, ultimately benefiting healthcare providers and patients. Another question: are egoism and altruism mutually exclusive? No. Individuals can exhibit both egoistic and altruistic tendencies, and the balance between the two may shift depending on context and personal value. The third question: how do healthcare professionals balance their own well being with the needs of their patients? Answer is: healthcare professionals must set boundaries, prioritize self care, and develop empathy to maintain balance and provide quality care. The another question: can society encourage altruism without neglecting self interest? Yes. Society can nurture altruism by promoting empathy, encouraging voluntarism, and creating a culture of compassion while still valuing self interest. Key takeaways: compassionate care is when a doctor treats a patient the way they would want their own family member to be treated. In GI and liver disease, compassionate care is not just about prescribing drugs, it is about offering hope, presence, and human connection. Whether it is through diet guidance, listening without judgment, or just sitting silently with a patient during a tough moment, it all matters. Patients remember kindness more than procedures. Make compassion your clinical habit. Compassion is not optional, it is essential to healing. You may not always have the cure, but you always have the power to comfort and connect. Let your presence, words, and silence carry healing. The best medicine may not be in your prescription pad, but in your heart and your words. Let's heal not only with our knowledge, but with our presence, compassion, and empathy. Treat the disease, but never forget to touch the life. 1 minute reflection. Before we close, I want you to take just 1 minute. Think of one patient you remember. Not because of the diagnosis or treatment plan, but because of the human connection you shared. Maybe it was someone who cried in front of you, or someone who just needed your reassurance. Now ask yourself, what made that moment memorable? Was it the medicine or the compassion? Final thoughts? Patients may forget your diagnosis. Patients may forget your diagnosis. They may forget your prescription. But they will never forget how you made them feel. As we move forward in our careers, new drugs will come, new endoscopic technologies will evolve, and guidelines will keep changing. But one thing will always remain timeless: the power of compassionate care. For our patients with cirrhosis, inflammatory bowel disease, or cancer, the real medicine is often not just what we write on the prescription page, but the comfort and dignity we provide through counseling, empathy, and presence. So, let us commit not only to treat diseases, but to touch lives. Because in the end, patient may forget what we said. They may forget what we did, but they will never forget how we made them feel. Once again, I'm grateful to my friends, Dr. Muslim Atiq and Dr. Muhammad Saleh, for their kind invitation. Although today I could only join you through a recorded message, my heart and prayers are with you in your noble mission of patient care. Inshallah, I look forward to meeting you in person and learning from your experience as well. Thank you very much, and may Allah bless your efforts.